Welcome to the unit Musculoskeletal Disorders and Imaging, unit number 401180. I'm Dr. Steph Pankala and I'll be presenting this information to you today. In general, this unit broadly covers a whole range of rheumatic diseases, bone disease, as well as neoplasms of the foot, ankle and lower extremity. Essentially, over the 13 weeks, you'll be learning about a whole range of these different disease processes in terms of their clinical presentation, the type of history that you need to take, how you will assess this, including things such as imaging, x-rays, ultrasounds, MRI, etc. Working out how you'll come to a clinical diagnosis, and then how you'll manage and treat the condition. So this is week 1, lecture 1, and this is the introduction to the unit. Your unit coordinator for the unit is Michael Wilding. So he will be your first contact and his email address is here. So if you do have any concerns or queries about the unit, they should go directly to Michael first. The teaching staff include myself, Marie Marks and Kate Carter. It is important that you do review the information available for you about the unit on the VIEW site as well as within the learning guides. Now the learning guides can be accessed directly from the VIEW site and they're also available at the library. It is your responsibility to make sure you understand the learning guide. This is where it has quite valuable information, particularly around your timetable, contact hours, as well as your assessment processes. So it is important to review this in terms of your timetable so that you're aware when you are scheduled. It provides, again, information around the assessment summary, and please do read the marking rubric. It is designed so that you can see in each category what the expectation is. In terms of your assessments, we do provide practice questions as well as some exemplars for the case study. The learning guide also provides you your contact details. Now there may be some additions to your contacts, so different lecturers as we get different people in to speak, and these will be added to your VIEW sites as we develop through the unit. So again, very important to look at your timetable. Attendance at the practical or lab is not compulsory, however it is recommended. Do remember that this unit in particular is teaching you a lot around rheumatic diseases, bone health, as well as neoplasms. These are items that you will see in clinical practice every day, every week, for the majority of them. So this is your learning area to learn about these diseases and how to diagnose and manage these in preparation for your clinical practice. So the recommendation is that you do turn up for these, all of these sessions. These are your learning outcomes for the unit. It is important to have a look through these so that you have an understanding of what this unit will entail. So if we just go through these relatively quickly, but you can also go back and have a look at these in your own time. So the first learning outcome is to analyse, interpret the etiology, pathophysiology and clinical manifestations of rheumatic diseases, bone disease, neoplasms of the foot, ankle and lower extremity. Now to enable this, you need learning outcome 2. So you need to be able to identify and demonstrate examination techniques such as history taking, clinical examination and further investigations. Needed to construct a differential diagnosis. So often you'll need to have an understanding there may be a few conditions it could be, and then you need to go through obtaining appropriate diagnostic criteria and implement a treatment program for a range of these musculoskeletal disorders affecting the foot, ankle and lower extremity. So essentially, as you diagnose one condition, you will then need to be able to manage it well. If your management plan is not going well, then you need to rethink your diagnoses. So it is important to understand how to assist your diagnosis through your examination techniques. Then into 3, to be able to manage this condition, you need to be able to distinguish and compare between the different range of treatment strategies. Now, this can include pharmacological, physical, mechanical, surgical, and alternative types of treatment. So there is quite a range of these available to treat rheumatic diseases and other musculoskeletal disorders of the foot, ankle, and lower extremity. Again, in terms of your diagnosis, you need to be able to differentiate and describe the history, development, functionality of different diagnostic imaging modalities, including radiography, commonly called X-rays, ultrasound, MRI, CT scans, bone scans. And these are there so that you can interpret different musculoskeletal tissue densities and anatomical structures of the foot, ankle, and lower extremity. So here we'll be showing you a whole range of different techniques and how you can identify what normal structure looks like and what pathology can look like to help you assist or confirm what you think your diagnosis is for this condition. Learning outcome 5, you need to be able to distinguish and demonstrate between the most appropriate imaging modalities and views needed for visualization of particular foot, ankle, lower extremity, anatomical structures and common musculoskeletal disorders, and develop referral skills for each of these modalities. So here we're saying is that each of the imaging modalities, for example, X-rays are very good to really show you structure and bone. However, whilst you can see some soft tissue, it doesn't really well define it really well. So something like an MRI can actually assist you to see very clearly the soft tissue structures. Bone scans, for example, can show you where there's hot spots. But they're not going to really be specific to particular tissue, can be the problem. So as we go through this unit, we will actually show you these different modalities, how you can refer for these modalities, what instructions you need to put in your referral, but also how to read and interpret the findings from these modalities. And again, these are a diagnostic assistant. So basically you'll have your diagnoses and these are to assist or confirm your diagnoses. So 6, essentially I've led you to this already, you're going to integrate the diagnostic imaging test results with your clinical examination. So again, you're either confirming or denying what you thought your diagnosis was. 7, you need to identify and appraise the indications, contraindications for a range of diagnostic modalities used in the foot, ankle, lower extremity, including radiography, ultrasound, MRI, CT, and bone scans. So what's saying here, there is actually a risk with these modalities, some more than others. For example, with X-rays, we have radiation. So this is really important. Some scans, such as MRI, you can't have metal in place. So if they have a hip replacement, excuse me, if they have a hip replacement, that they can't actually have an MRI. So there are certain indications and contraindications to each of these modalities. So you need to understand what the level of risk is. Also, there's also a cost. So really, do you need that imaging technique? Is there a cheaper one to have that's going to be much more effective in assisting your diagnosis? 8, you need to be able to analyse and compare the legal, ethical, and medical ramifications of using these different diagnostic imaging modalities to investigate common musculoskeletal disorders of the lower extremity. So again, what it's saying is that we shouldn't be over-prescribing these modalities. You should have enough clinical skills to make a diagnosis and these to assist your confirmation of that diagnosis, or you may need to look further. So again, it's about not overusing modalities, but using them appropriately. So what is the unit content for the unit? Well, this leads on from the learning outcomes. So you'll specifically be learning a lot around osteoarthritis, rheumatoid arthritis, something called seronegative arthropathies, systemic disorders of children, crystal arthropathies, so a nice example of that is gout, traumatic injury and anomalies, connective tissue autoimmune arthropathies, bone disease, so again a nice example would be osteoporosis, metabolic and endocrine disorders, things maybe such as Paget's disease, soft tissue and bone tumours, as well as looking at things such as educational resources for patients and how you can actually develop these and the impact on their management. Importantly, history taking is really paramount, and this is going to help you with your confirmation of diagnosis. It gives you an understanding of potential differential diagnoses, what diagnostic imaging you may need to undertake, the types of testing and assessment techniques you need to undertake, how you're going to use clinical reasoning to actually come up with your diagnosis and management plan, how you're going to implement that management plan, what the health outcomes, how you're going to measure how well your management plan is working out, as well as the need and integration of multidisciplinary care. Assessment of the unit. There are 3 assessments in this unit. One is the case study, and then there's 2 exams, one practical exam and one written final exam. The case study is worth 25%, as is the practical exam, and the final written exam is worth 50% of the unit. The case study is due on Monday the 7th of October at 5 p.m. The practical exam will take place at 9 a.m. in the lecture time slot on Thursday the 29th of August, and the final written exam will take place in the formal examination period. There are no thresholds on these assessments, which basically means you just need a 50% overall pass for the unit. You do not need to pass specific assessment items. One of your assessments will be a case study assignment. This is worth 25% of your mark and is due on Monday the 5th of October, submitted via Turnitin via your views link. In this assignment, you can actually choose your own case or topic, and this is generally from rheumatoid arthritis, one of the crystal arthropathies, for example, gout, or osteoarthritis. So essentially it's where the disease is affecting the lower limb that is impacting on the person's mobility and quality of life. So in this assignment, you have the freedom to develop your own case study and decide on the extent and the effect of that disease on the person's mobility and quality of life. So you have the option of choosing, for example, a disease process early on where there's not a lot of structural damage, or you may decide that you want to look at for example, someone later down the case where there is quite a lot of structural damage. So the choice is yours to the level that you want to take this. But what's going to be really important is that you describe the case in relation to the disease process, the clinical presentation, and the effects on the quality of life and mobility. To what extent is it affecting them? And we will be discussing each of these conditions as we go through the unit prior to this case study being due. We also want you to talk about the epidemiology of the disease. So how common is it? And we also want you to consider using an evidence-based podiatric therapeutic intervention that's relevant to the case. And importantly, you will need to argue the case in terms of the most appropriate health outcome measure to monitor your prescribed podiatric intervention. So what we're asking you is to describe a case really well, tell us how it's affecting the person, how you're going to manage this, why you've chosen that particular way in terms of the evidence, and then how you're actually going to monitor this to know that your treatment is actually really effective. Now, the word limit is 1,500 words. However, we do allow you 4 tables, and these are not counted in the word count, but these tables you could actually use to put your evidence in. So, for example, you could have one table that looks at the epidemiology of the condition. You could have one table that looks at different managements. So if we just looked at the epidemiology, you might find that there's 4 studies. So what you want in there is the author, the year of publication. You want to know something about the sample sizes of the information or the type of research. Essentially, their data collection method, so it's a survey, commonly in epidemiological studies. And then you want to actually basically give a summary of what their findings were. In this way, you can actually group your information, and it makes it easier when you're writing up because you can just provide a summary and then refer to your table. But that summary should be something that would say that you found 4 studies around the epidemiology of osteoarthritis and found that in sample sizes between 30 to 1,000 people that the prevalence of osteoarthritis was whatever percent, and that this varied between these percentages. And you could then explain that maybe the studies that had the larger sizes of participants are maybe more relevant to your case than the smaller ones, but that's not always the case. It could be that the smaller studies are more relevant to your case because they're more like your type of population in terms of age, gender, ethnic background. So you can use these tables really wisely to provide yourself a really nice summary of the evidence around your case. And this is also a very good learning tool that you can actually take into your following units as well. This is an example of how you can set up one of your tables around epidemiology for your assignment. So this is actually a student example from quite a few years ago now, so around 2013, 2012. And she was actually interested in her topic around looking at knee osteoarthritis in rural versus urban communities in developing countries. So that her case would have been someone who's actually come from one of these communities. And how she set this up then was to actually look at the country. So she's interested if the country had an impact on the prevalence of knee osteoarthritis. So she's then provided information about the reference, so you can look it up. It tells you the demographic area that the study was done, so if it was rural versus urban. It looked at the gender percentages, so if there's more or less females versus male ratios. We also look at the age, and you can see at the age these studies are quite variable. You've got some that really are just looking at anybody over 15, so sort of coming into adulthood. You've got others where they've got a mean that's around in the 30s. You have others that, like the Japanese study at the bottom, that's looking at a mean of 70 years of age, so a much older group. You have sample sizes, if you look quickly down there, between 873 all the way through to 4,092. And again, you can actually see the percentage knee osteoarthritis varies quite a lot. And so if you exclude the Japanese study at the bottom at the moment, you can actually provide a nice summary of this information of those first 6 studies, talking about that, how the prevalence of that disease of knee osteoarthritis in the knee is between 1.8 and 11.5. So the way that you could actually summarize this table could be something like we put at the bottom here. So the epidemiology of knee osteoarthritis is reported to be between 1.8 and 11.5% in 6 studies with sample sizes between 873 people and 4,092. And you need to obviously put your references in there. However, one study, again your reference, reported that knee osteoarthritis to be as high as 54.6% in a study which was more specific to older people, so it had a mean age of 70.6. Excuse me. So what I'm trying to say here is there's different ways that you can display your You display this information, but there's different ways you can report it depending on what the focus of your case is. So for example, if you had someone who's sitting around more of a mean age of around 35, and they're from an Australian population, then the Australian population of 35 degree age would be the percentage that your person's more likely to sit in. So there are different ways to explain the data and to explain the variations in the data. But again, what you're trying to do is build that argument about your case. A reminder again that the rubrics are really important to have a look at. These are your guides for all of your assessment tasks, and they do provide quite valuable information, particularly around the assignment about what content you need to include. So for here, you can actually see that we have information around how you're going to present the case, as well as the epidemiology. So you'll need to look more at this for greater detail for each of the areas. But this is just an example of some of the components that you'll see in the rubrics. So, for example, in the clinical history, under high distinction, it says you need to look at all aspects of the clinical history, that they're succinct, it describes to a high level of detail. And that essentially basically means that if you gave that case to someone, they'd be able to identify that person really quickly according to the information that you've actually provided. And they would actually be able to make really useful clinical judgments just from that information that you've provided. So it needs to be quite detailed but succinct so that you're being, to the point of understanding. It will also provide the clinical history presented includes high relevant aspects that are typical to the condition, so that they're relevant again to the condition, and so that you really understand how those typical features associated will apply to your case. On the other end of the spectrum would have the unsatisfactory, which basically says that you're really describing the case really poorly. It's really disjointed, it's inaccurate, it's really not typical of the condition that you're presenting, you're not clear about your condition, so you're showing a poor understanding of the typical clinical features that you would expect to see in this condition. So it is important to think what your condition is, typically how it presents, how you would present that, and how can you provide that information in such a way that it provides the detail that someone could quickly just step into your shoes and understand that case. Again, you should look at each of these categories and see what you're trying to aim for. And again, it is your responsibility to make sure that you're understanding these rubrics, and if you are having issues, then certainly Michael Wilding as your unit coordinator would be your first point of call, and I'm sure that there will be discussions about the assignments that will come up through the classes as well, so that we will try to give you information to make sure that you can achieve this assignment well. And there is an exemplar as well, so do have a look at the folders around your assessment, because they do actually often have additional information that will assist you to complete your assignment. In your assessment criteria, you actually have 2 exams, so 1 case study and 2 exams. So assessment 2 is your practical exam. It's worth 25%. Assessment 3 is your final exam, and it is worth 50%. Your practical exam will occur in your lecture time slot at 9 AM on the 29th of August. The formal or final exam will occur in the final exam period. So your practical exam will test your ability to identify the clinical presentation, diagnostic imaging of different musculoskeletal techniques. So it's much more applied, really, more so to around some of the image techniques. It's a 1-hour exam. There will be sample questions that will be used in the tutorials and practical sessions. And the questions will be a range of short answer as well as labelling questions. So an example of a labelling question would be around an X-ray presentation to identify a particular pathology, for example. Again, we'll provide examples for this as we go through the unit. In the final exam, again, 50% worth of your mark. It's a 2-hour exam. It will be in the formal examination period. The questions will test all your material covered in your lectures, tutorials, practicals, and further reading. And that is important that you are actually doing that background reading for that reason. There will be sample questions again used in the tutorials and practical sessions so that you're more aware of what's going on. And the questions will be a range of multiple choice, short and long answer questions. There is definitely more detail in the learning guide also that you can actually read, and make sure that you're looking at the rubrics for each of these assessment tasks as well. So welcome to the unit. I hope you enjoy the unit, and remember your first port of call if you're having any concerns is your unit coordinator, who is Michael Wilding, and again his email is listed here.